What is Femiplan Everyday Pill? It's a daily oral contraceptive pill used to prevent pregnancy. What does one packet of Femiplan contain? Each packet contains 28 pills, 21 yellow active pills and 7 brown iron supplement pills. What is inside the yellow pills? Each yellow pill has 0.15 mg levonorgestrel and 0.03 mg ethinyl estradiol. What is inside the brown pills? Each brown pill contains 75 mg ferrous fumarate, which is an iron supplement. Why are there 21 yellow and 7 brown pills? The yellow pills prevent pregnancy, while the brown pills help with iron supplementation during menstruation and maintain the daily habit of pill taking. What is Femiplan used for? It is used for the prevention of pregnancy. How should Femiplan be taken? It should be swallowed orally, 1 pill every day. When should the pill be taken? Preferably at the same time each day, either with the evening meal or at bedtime. How does Femiplan prevent pregnancy? It works by suppressing ovulation, thickening cervical mucus, thinning the uterine lining, and reducing sperm transport through the fallopian tubes. What does suppressing ovulation mean? It means the pill prevents the release of an egg from the ovary, so fertilization cannot occur. What does thickening cervical mucus do? Thicker cervical mucus blocks sperm from passing easily into the uterus. What happens when the uterine lining is thinned? A thin uterine lining is less receptive to a fertilized egg, lowering the chance of implantation. How does Femiplan affect sperm movement? It reduces sperm transport in the upper genital tract, especially in the fallopian tubes. How effective is Femiplan at preventing pregnancy? It is highly effective when taken daily, with a failure rate of 0.1 to 8 pregnancies per 100 women in the first year of use. When does Femiplan become effective? It is effective immediately when started within the recommended time frame. Is a pelvic exam required before starting Femiplan? No, a pelvic exam is not required before use. What makes Femiplan convenient? It has few side effects, is easy to use, easy to stop, and can be provided by trained non-clinical staff. Does Femiplan have non-contraceptive benefits? Yes, it can improve menstrual symptoms, reduce anemia, regulate cycles, and protect against certain cancers and diseases. How does it affect menstrual flow? It decreases menstrual flow, making periods lighter and shorter. Does it help with menstrual cramps? Yes, it decreases menstrual cramps. Can Femiplan improve anemia? Yes, the iron in the brown pills and reduced bleeding may improve anemia. Does it affect menstrual regularity? Yes, it often leads to more regular menstrual cycles. Does Femiplan protect against cancer? Yes, it reduces the risk of ovarian and endometrial cancer. Does it affect the breasts or ovaries? It decreases the risk of benign breast disease and ovarian cysts. Can Femiplan prevent ectopic pregnancy? Yes, it reduces the risk of ectopic pregnancy. Does it protect against infections? It protects against some causes of pelvic inflammatory disease, PID. Are there limitations to using Femiplan? Yes, its effectiveness may be lowered by some medications, forgetfulness, or rare but serious side effects. Which medications reduce effectiveness? Certain drugs for epilepsy or tuberculosis can lower its effectiveness. What if a woman forgets to take her pills? Forgetfulness increases the risk of pregnancy. What are the rare but serious side effects? Heart attack, stroke, blood clots in the lung or brain, and liver tumors, though these are very rare. Does Femiplan protect against STDs? No, it does not protect against sexually transmitted diseases, including HIV, AIDS. Who can use Femiplan? Almost all healthy women of reproductive age can use it. Can women who have never had children use it? Yes, even women who have not yet had children can safely use Femiplan. Can women of any parity use it? Yes, women with any number of children, or none at all, can use Femiplan. What about women with established menses? Yes, women who have regular menstrual periods can use it. Can breastfeeding mothers use Femiplan? Yes, but only if they are more than 6 months postpartum. Can women who have recently had an abortion use Femiplan? Yes, they can start immediately or within 7 days after an abortion. Can women with anemia use Femiplan? Yes, especially those with anemia caused by heavy menstrual bleeding. Does Femiplan help women with severe menstrual cramps? Yes, it can be used to relieve severe menstrual cramps. Can women with a history of ectopic pregnancy use Femiplan? Yes, women with such histories can use it safely. Can women with migraine use it? Yes, but only under medical supervision. Can women with sickle cell disease use it? Yes, but only under medical supervision. Who should not use Femiplan? Some women should avoid it due to health risks. Can pregnant women use Femiplan? No, women who are pregnant should not use it. Can women who are less than 21 days postpartum use it? No, non-breastfeeding women who are less than 21 days after childbirth should not use it. What about breastfeeding mothers under 6 months postpartum? They should not use Femiplan until after 6 months. What if a woman has unexplained vaginal bleeding? She should not use Femiplan until the bleeding is evaluated. Can women with active liver disease use Femiplan? No, it is contraindicated in active liver disease, such as viral hepatitis. Is smoking a concern? Yes, women who are over age 35 and smoke should not use Femiplan. What about women with high blood pressure? Women with blood pressure is greater than or equal to 160/100ths of a millimeter of mercury should not use it. Can women with lower blood pressure use it? Yes, women with blood pressure below 160/100ths may use it under medical guidance. Can women with heart disease use Femiplan? No, those with a history of heart disease should avoid it. What about women with clotting problems? They should not use Femiplan due to risk of blood clots. Can women with diabetes use Femiplan? Those with uncomplicated diabetes may use it under supervision, but women with diabetes complicated by vascular disease should avoid it. Can women with a history of breast cancer use Femiplan? No, but women with benign breast disease may use it safely. Can women on epilepsy or TB drugs use Femiplan? No, these drugs reduce its effectiveness. What if a woman cannot remember to take a pill daily? She should not use Femiplan, as forgetfulness increases failure risk. Does Femiplan protect against STDs? No, it does not. Women should use condoms alongside it to prevent sexually transmitted diseases, including HIV, AIDS. When can Femiplan be started? It can be started at different times, depending on the woman's situation. Can it be started anytime during the menstrual cycle? Yes, if it is reasonably certain that the woman is not pregnant. When is the best time to start if using for the first time? Days 1 to 7 of the menstrual cycle, with days 1 to 5 preferred and day 1 being best. What if a woman is already using Femiplan? She should start the new pack the day after finishing the old one, with no break. What if switching from another contraceptive method? She can switch immediately, with no need to wait for her period. When can postpartum women start Femiplan? If breastfeeding, after 6 months. If not breastfeeding, between 3 to 6 weeks postpartum. What about after an abortion? Femiplan may be started immediately or within 7 days. How should a woman start taking Femiplan Everyday Pill? She should press the bubble beside the start arrow on the pack to release the first pill. Why should she press the start arrow bubble? It helps her follow the correct sequence of pills in the cycle. What else should she do when starting the pack? She should write down the day she took the first pill on the line provided. Why is writing down the first pill important? It helps her track if she has missed any pill later on. How should she continue after the first pill? She should follow the direction of the arrows on the pack, taking 1 pill daily. When should she take her pill each day? At the same time daily, preferably with the evening meal or at bedtime. What happens after finishing the 21 yellow pills? She will usually start menstruating a few days later, while she takes the 7 brown iron pills. Why are there brown pills in the pack? They contain iron supplements to prevent anemia during menstruation. How should she continue after finishing the first pack? She should start a new pack immediately, there is no resting period. Where should she begin with the new pack? Again, at the pill beside the start arrow. Why is there no rest period between packs? Because continuous daily use maintains effective protection against pregnancy. What happens if she vomits within 30 minutes of taking a yellow pill? She should use condoms if she has sex until she has taken yellow pills for 7 days in a row. What if she forgets to take 1 yellow pill, active pill? She should take the missed pill as soon as she remembers, then take the next pill at the usual time. Will this mean taking 2 pills in 1 day? Yes, but only in the case of 1 missed pill, and it is safe. What if she forgets to take 2 or more yellow pills in a row? She should take 2 pills each day until all missed pills are covered. How should the 2 pills be spaced? She should swallow the second pill 6 hours after the first to reduce nausea. What additional precaution is needed if 2 or more pills are missed? She should use condoms for 7 days to avoid pregnancy. What effect can missing 2 or more pills have on her period? Her next period may come earlier than expected. What should she do when her period starts after missing pills? She should begin a new packet on the first day of her period. What should she do with the old packet if pills remain? She should throw it away, even if some pills are left. What if she forgets to take any of the brown pills, iron supplements? She should not worry, she is still protected from pregnancy. What should she do about the missed brown pills? she should leave them and continue with the remaining brown pills on schedule. Does missing brown pills affect contraceptive effectiveness? No, only yellow pills, active pills, affect pregnancy protection. What should be done if a period is missed? If a woman has followed the schedule perfectly but misses a period, she should return to the clinic for a pregnancy test. What if she has not followed the schedule and misses a period? If she has missed pills and then misses a period, she should also go for a pregnancy test. Can Femiplan Everyday Pill be used for a long time? Yes. If a woman is in good health, she can use Femiplan without stopping for as long as she wishes to prevent pregnancy. What happens when a woman stops using the pill? As soon as she discontinues, her body begins preparing for pregnancy. How soon can fertility return after stopping Femiplan? Usually, within 2 to 3 months, most women regain their fertility. Will stopping the pill affect the health of a future baby? No, once a woman conceives after stopping, she should expect a normal, healthy baby. Why is it important to counsel women about fertility return? Because some may wrongly believe that pills cause long-term infertility. What is a major cause of infertility among Kenyan women and men? Sexually transmitted diseases, STDs, that are not properly treated. How can women protect their fertility while on the pill? By using condoms alongside the pill to prevent STDs. What should women ensure regarding STDs and partners? Both she and her partner should be tested and treated for any STDs before continuing unprotected sex. What are some signs of possible STDs? Foul-smelling or itchy genital discharge, sores or swellings on genitals, groin, painful urination, lower abdominal pain, or a skin rash. Can people have STDs without symptoms? Yes, especially women. Many infections can remain silent but still cause damage. Common side effects. Are most side effects of the pill serious? No, they are usually mild and temporary. When do side effects commonly occur? Mostly within the first few months, while the body adjusts to the hormones. What mild side effects might women experience? Nausea, occasional vomiting, dizziness, weight changes, mild headaches, moodiness, or breast tenderness. Can women experience bleeding between periods? Yes, minor spotting between cycles can occur in the first few months. Should women be worried about these discomforts? No, because they are not harmful and usually go away with time. When should a woman seek medical advice about side effects? If the discomfort persists or she feels worried about her symptoms. Warnings, rare but serious side effects. Are low-dose family planning pills generally safe? Yes, they are safe for most women, especially non-smokers in good health. Can the pill cause life-threatening problems? Rarely, but yes, very serious complications can occur. What are the rare but serious risks of the pill? Blood clots in the legs, lungs, brain, heart or other organs, brain hemorrhage from a ruptured vessel, liver tumors, severe bleeding, high blood pressure, and gallbladder disease. How does smoking affect pill safety? Cigarette smoking greatly increases the risk of heart and blood vessel complications in pill users. At what age is smoking with the pill especially dangerous? Over age 35, particularly with heavy smoking, 15 plus cigarettes per day. Drug interactions. Do some medications reduce the effectiveness of the pill? Yes. Drugs like rifampin, for TB, and many anti-epileptic drugs make the pill less effective. What should a woman do when starting a new medication? She should inform her healthcare provider so adjustments can be made. Warning signs of serious problems. What are warning symptoms that should not be ignored? Severe constant headache with vision or speech problems, or severe upper abdominal pain. Why are these signs important? They may indicate serious conditions like stroke, clotting, or liver disease, which need immediate medical attention. What should a woman do if she experiences these signs? Stop the pill immediately and return to the clinic for evaluation.